Hello, everyone. My name is Rita Omene. I'll be educating the public on the concept of healthcare equity and reason why it should be observed when it comes to accessing medical services. Choosing between two ways of information sharing, I will be providing the definition of healthcare equity as well as discussing the implications of the concept. Therefore, by employing the informative style of writing, I will be able to explain this important issue. Healthcare equity means that all people should receive adequate healthcare services irrespective of their financial situation, the color of their skin, and the geographical location. Solving this problem it is important in order to encourage the development of healthcare society and to decrease avoidable mobility. It will be a topical categorical method to organize organization. This approach enable me to define the healthcare equity, discussing the root cause of disparity and discussing how the problem can be solved. I can arrange my ideas and information in a way that it will easily be understood by my audience. I would like to address anyone interested in public health, community activists and policymakers. Consider a woman carrying a sick child to the emergency room and being turned away because she has no health insurance. This is not an imaginary story. Such thing occur in everyday situation in our everyday lives. Healthcare equality affects millions of people and cause unnecessary pain and even death. As a nurse, the inequality are evident in my everyday practice. In this post, I will explain what healthcare equity is and why inequality persists and how change can be implemented to improve the lives of millions of people. Let's uh, let's discuss healthcare equity. Healthcare equity is not a matter of a matter of policy, but just a matter of conscience. Healthcare equity means that every person should be able to get the healthcare they require, irrespective of their income level, race, or geographical location. WHO define healthcare equity is as avoidance of unnecessary and unfair inequality in a health of difference on a different population group and in this access to healthcare services. This concept is based on the fact that health is a fundamental right, a human right. Factors that hinder the achievement of healthcare equity include high cost, lack of insurance, and variation in access to facilities. For example, the urban hospital always congested, while the rural have severe shortages of health facility and personnel. Also, the minority experience systemic prejudice in the healthcare system, which results in adverse outcome. Although this barrier may be at times appear very difficult to overcome, this paper will exploit some creative and collaborative way to manage them. To manage them. Healthcare equity is not just a gender for provision of healthcare services. It is a question of justice and human right. With this definition of healthcare equity in mind, knowing the barrier that exists as well as the possible measures that can be taken to eliminate them, it is possible to work towards a future in which no one is excluded from receiving necessary medical care. I encourage you to ask yourself how you can support this important mission. Together, we can work to make healthcare a right for everyone in the world and not just a privilege. Thanks.